Knock, knock. Hi, Joe. My name is Tony Pillow, student here at Southwest Tech. I'll be taking care of you today. I think we got some meds that we need to have you take today. Is that okay with you? Okay, good. Well, let's get started. Oh, let's see here, Joe. I'm going to look at the doctor's orders here first. Make sure we got everything is the right order here. We've been working, make sure that everything's in order here. Okay, what was your last name there, Joe? Smith. Okay, very good. Date of birth, 10/5/1953. Very good. Any allergies? Sulfa. Okay, good. Looking like we got the right sheet here. Let me just double check your wristband. Very good. Excellent. Okay. I'm just going to give us a little privacy here, Joe. And I'm going to wash my hands and we'll get started. Okay. I need to look at the doctor's orders here. Yep, and it does look like we might be due for some meds today. I'm just going to double check and see what we have here. Okay, so I'm double checking the doctor's orders to what we call the medication administration record. So what I've got on here, I've got the digoxin, 0.125 milligrams orally. Digoxin, 0.25. Okay, this pill is too big. We'll have to deal with that later. Package looks good. Expiration date looks good. I have furosemide, right here, 40 milligram tab. 40 milligram, expiration date's good, package is intact. Very good. I've got Coumadin down here. And I have Coumadin warfarin. Okay, very good. 5 mil tabs, expiration date is good. Package looks good. And that's by mouth 5 milligrams once daily. By mouth 5 milligrams once daily. Okay, good. Those are all jiving fairly well. I've got one more pill here. What is that? Okay, gotcha. Oxycodone APAP. That's a pain med. And here it is on the back. Oxycodone APAP, acetaminophen, which is basically Tylenol. We'll talk about that. 5, 325 respectively. 5, 325 respectively. Okay, very good. That can go over there. So we just got one kind of that we want to keep on do something different with. All right. So I checked those. Packages look good. Expiration date looks good. I just want to talk to you about these meds a little bit. First off, the digoxin. As you know, you came in with heart issues. What the digoxin does, that's called anti-arrhythmia. You had an arrhythmia. The digoxin is going to slow down your heartbeat a little bit, but it also makes your heart work more efficiently, so you get more of a sound heartbeat and a better pumping action. So that's what that's all about. So that stuff, obviously, one of the side effects, and what we want it to do, therapeutic effect as well, is to slow your heart down a little bit. It's going to beat more efficiently. But we don't want it to get too slow, of course. So that's one thing we want to for sure check. We've got to make sure that you're above 60 heartbeats per minute, or we don't get that med today. So again, slow heartbeats, a small or a mild effect. One more serious effect is what you want to watch for is if you start seeing halos or fuzziness when you look at light. It might be a sign you're getting too much. If you start getting, if it starts making you nauseous, or if you take it for a long time, you don't feel like eating, and you might be some weight loss or vomiting, definitely want to look at that med. It's got a relatively narrow window with the therapeutic effect is what they call it. So we do run serums on it, and you want to be between 0.5 and 2 nanograms per deciliter on that. Your labs came back today, they're 0.5, so we will be giving that med today. What I do want to do is listen to your heart rate real quick here, though. Make sure you're above that 60. So, I'm going to come down to your angular, fifth intercostal face down, mid-clavicular, and I'm going to listen here. And I just want to make sure if I haven't listened a whole lot, or to you quite a bit, I want to listen to that full 60 seconds. Okay, good. So you're running about 70 today, so you're okay. So we're all green light go for the dioxin. All right, next one I'm going to talk about here is furosemide. Lasix is its common name. So the furosemide, if you remember, you came in, you had some swollen legs. That's called edema. Basically, it means that your body's not working efficiently enough getting rid of water out of your system. So this is furosemide is what we call a diuretic, which in a nutshell, it's going to help your body be more efficient at getting rid of water, i.e., you're going to be urinating more until we kind of catch up and get rid of some of that edema. That being said, one of the mild side effects is, of course, you're going to want to go to the bathroom, 15, 20 minutes after we give you that med. So make sure we'll get you a call light and make sure and take care of you. Make sure and call for one of us to help you to the bathroom a little bit. So yeah, again, the common side effect is it's going to want to make you go to the bathroom. Less common, or something that's a little more serious, is that because you are going to the bathroom more, it could mess up your electrolytes, meaning it could kind of flush out your system too much. So one electrolyte we want to make sure you maintain is the potassium. Potassium is very important in keeping a healthy heart rhythm going. So we do want to make sure and check your potassium levels. So we got your labs back on that. You're a 4.3 on potassium. So that's right in the middle. So we're okay on the potassium levels. So we are going to go ahead and give that Lasix today. All right. Next off, the warfarin, Coumadin. They use them interchangeably, but Coumadin's the proper name. So what that does, that's an anticoagulant, actually. Now, because we got this arrhythmia going on a little bit here, the fear is that if blood doesn't circulate in all the areas of your body as well as it should, that the blood will sit in one spot and try to coagulate. So to prevent that from happening, we go ahead and we give Coumadin. And what that does is it's a blood thinner, and it just helps helps your blood stay more viscous so it doesn't clot. We have mild side effects of bruising and maybe a little bit of lightheadedness with the Coumadin. That's just normal, so you got something to pay attention to. But even what's more important to pay attention to is some of the more serious side effects. Say, for instance, if you're shaving, you cut yourself, and you just wouldn't want to stop bleeding. That's a sign that you want to get your labs checked. Brushing your teeth and have excessive bleeding in your gums is another sign. If you are going to the bathroom and you have a darker cola colored bathroom in your urine, that could be a sign of internal bleeding, as well as some really dark stool. You want to pay attention for that. That could be a sign that you might have something going on the inside. But you want to keep up on your labs on Coumadin because they will go up and down quite a bit. We did take your labs. Your labs is called your INR, and it should run between a 2 and 2.5, and you are a 2. So you are going to get your Coumadin today. All right, the last one I got here is a combination drug, and that is for pain. So I wanted to talk to you about that. That's called oxycodone and acetaminophen, or oxyapap, also known as Percocet. What did you say your pain level was? I know they've been asking you quite a bit. You're thinking around a 4? Okay. So we've got a PRN order here. When was the last time you took that? Okay, so you're good to go on that. It's been over our time limit. Yeah, that was 6 hours ago. Okay, so we're good. If you need to take some of that, I'll just go ahead and give you one of those. Is that okay? Okay, we'll plan on one of those as well. So a little bit about that. Oxycodone is an opiate. It's a narcotic. You got to watch out. You don't want to use this too long. It does have run a chance of becoming addicted to it. So that's something to be aware of. Like any of the narcotics, dizziness and drowsiness is going to be a side effect. It'll help you rest and relax. If you take it for a period of time, constipation could be an issue. We don't really check for labs on this, but what I want to make sure is just that you're kind of coherent, not having a bad reaction to the last med you took. Make sure that you're relatively alert and not having a bad reaction to that. And then I check your respiration to make sure, and I've been watching that. We're above a 12, so as long as you feel comfortable with it, we'll go ahead and give that to you as well. Now the acetaminophen in there, or the Tylenol, that's as dangerous as anything. So we went ahead and we checked, and we know that your liver, you haven't had any problems with your liver, because acetaminophen can be hard on your liver. So we are good on both ends of that. We will be going ahead and administering that today because we've got normal labs on that. Okay, I'm going to go ahead and check my meds here again. And again, I've got digoxin over here. I know that's too big. Package is good. Expiration date. I've got the Sklvidmed 5 milligram tab. Good. I have got the Sklvidmed 40 milligram tab. Good. Expiration date. Good. Package good. I have got the pain medication combination 325 oxyacetamin respectively, and we're good on the time on that. Alright, that's good. So I just wanted to mention that, you know, as a patient, we got 5 things that we need to check, the 5 rights. So we want to make sure that we got the right patient. We want to make sure we got the right medication, the right dosage, the right timing of the medication, and the right way to administer the medication. That's what we got to check each and every time, 3 times, to make sure that we are not making a mistake. So I'm just going to check these one more time. Digitalis. Okay, I'm going to go ahead and open this one. This is the oxyacetaminophen, and we checked it. It's good. We'll put that in there. The furosemide, 40 milligram per mouth, time's good. Expiration date's good. You've got the warfarin, 5 milligrams orally. Package good. Nothing looks suspicious about that pill. I am going to maybe just quick put a glove on. Get off my pill splitter, because this guy is digoxin. You need to get that cut in half. Nice cut. Okay, we've got those meds in there. How do you take your meds, Joel? You okay taking them? Okay, just all at once and a little bit of water? Alright, let's throw these things back here. I'm just going to raise your bed up so you can get a good swallow in, so they're about 67 degrees there. Okay? Okay. Very good. Alright. Take these off. This off. Wash my hands. You want that bed lowered, more comfortable? Here's your call light. You might be going to the bathroom in a few minutes. Is there anything else I can do for you while I'm here? Okay, good. I'm just going to make sure to record this over here. Where my pen went. And record that we took this. This I'm going to dispose of properly. It's half of a pill, and I'm going to dispose of it based on however the institution tells me to dispose of it. Got your call light, and if there's nothing else I can do for you, thank you very much. You've been a great patient. Okay, bye-bye.